So sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So pina-check namin as OPD. Chinek, binigyan resetahan ng gamot. Tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tiningnan. Tapos in-advise na lang kami, linis. At 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdi-debride, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos, yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then, secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulite siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya, na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, hindi naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag ko, parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo, kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Ay, Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Hi everyone, I'm Sheila and welcome to another enlightening episode of Simply Healed webinar. This program is brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. We are an international distributor of food supplements derived from a unique strain of microalgae known as PPARS, which has been tested, tried, certified, proven to support not only cancer treatment, but also enhance general health and reverse metabolic syndromes like hypertension, diabetes, and high cholesterol. Just to recap on our last week's topic, last episode we discussed diabetes and cancer, connections and solutions. Lots of questions were asked, and most importantly, answered by our experts. And this week, discover how cancer and metabolic illness patients can benefit from PPARS because tonight's topic is entitled Breast Cancer Chemo, Successful Chemo. Breast cancer is one of the most common cancers worldwide, but thanks to advances in treatment, more patients are surviving and thriving after chemotherapy. Successful chemo not only targets cancer cells, but also helps improve long-term outcomes when paired with proper immune support and recovery strategies. One example would be Simply Nature PPARS. Many patients fear the side effects, but with the right approach, chemo can be more tolerable and effective. In this webinar, we'll share insights on how to navigate chemotherapy successfully, reduce complications, and support your body for the best possible results. So without further ado, let's dive right in. Please note that we will be having an AMA or Ask Me Anything portion later on, so please feel free to drop your questions in the comment sections. Now, leading our discussion tonight are distinguished health experts. First, I'd like to introduce a successful entrepreneur and seasoned international speaker on topics ranging from personal success to healthcare. He is the CEO and founding director of Simply Nature International, Mr. Shyan Lim.
Hi Sheila, good evening everybody. So good to see everybody again. Once again, today's topic is actually, we're moving back onto the topic of cancer. Last 2 weeks, we've been covering other subjects, and we really enjoyed the lively discussion on non-cancer subjects. Well, tonight we're going back to breast cancer and the most common type of breast cancer among women, which is breast cancer. And of course, with the development of chemotherapy and oncological protocols, tonight we're going to focus on how our protocols can support those of you who have chosen to do conventional treatments. All right, now again, our Ask Me Anything segment, you can ask anything, including how to treat cancer completely naturally as well. So yeah, look forward to your questions, and Dr. Jansen will be joining us in a while after the discussion. Sheila, I'll hand the time back to you as you introduce Dr. Jansen for his short discussion and lecture.
Thank you, Sir Shyan. Now, on to our next health expert. It's an honor to present our esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomate of International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. Currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Please join me in welcoming Dr. Jansen Kalalan. Let's all watch this.
Hi everyone, welcome to another episode of Simply Healed. And Dr. Jansen, welcome again.
Hello, Shyan. Hello, everyone. Glad to be here again.
Doc, today's topic is really interesting, and I think all our audience today will be so glad that they didn't miss today's episode, because today's episode is about why your breast cancer treatment might not be working.
Sometimes there are a lot of reasons why the conventional treatments that we undergo, even natural treatments, sometimes they don't work.
Yeah, but it worked like for other people at the clinic, right?
Why didn't it work for me? I mean, we're practically the same, right? The profiles are the same. So there are a lot of reasons behind that. So immune system evasion, gene mutations. But there's one specific pathway that once it mutates, then it's really very difficult to treat.
Okay.
So this pathway is the JAK-STAT pathway. Okay?
Is this something relatively new?
Actually, it's not.
This discovery,
it's not.
Okay.
But the drugs that have been developed to target this specific pathway are new.
Oh.
Quite new.
Okay.
Yes. So later we're going to tell you which drugs are there.
That's exciting.
Okay. Remember what I just mentioned, though, the JAK-STAT pathway. So that is JAK/STAT. So what is this? So cells have a way to communicate.
All right.
They talk to one another.
Okay.
Now, you know when we communicate, right? I am talking, you are listening.
Yeah.
So how do you listen? You have your ears to listen. Okay? So this JAK-STAT pathway are your ears. This is the ears of the cells.
Okay.
Okay?
That's
So
interesting.
if one cell is trying to communicate with another, it communicates via this specific pathway. JAK means cyanus kinase.
Oh, okay.
Okay, Janus kinase is just the name of the scientist who discovered this.
Oh,
So that's why it's
okay.
Janus. Okay, so it's Dr. Janus. Okay, and the other one is STAT. So STAT means signal transducer and activator of transcription. So this is specific big words. Okay,
Yeah.
main function of this that you have to know is that it stimulates gene activation. Okay, it activates the genes to manufacture proteins. Imagine this to be like a restaurant, okay, inside the cell.
Okay.
So take a look at this image. Okay, so take a look at the jack. Okay, imagine this jack to be counters, no, counters in the restaurants where
Like
you
the cashier,
go-
where the
the
where you
cashier.
order.
Yes, it's like where when you go to Jollibee, when you go to McDonald's, it's the lady in front of you where you order.
All right.
Okay, and the ligand, okay, is you. You are the ligand. You are the customer.
Okay.
Okay, of course, if you order
Yeah.
from the cashier,
They will produce
the food for you.
Behind.
Okay?
Yes.
So how does this work? Okay, so in a typical restaurant, when you order, the cashier receives your order, and then the cashier passes it onto the kitchen.
Yes.
So that the kitchen will make your order, will make your food to give it to you.
Yes.
Okay. So all right. So imagine this restaurant to be inside the cells. Okay. So you as the customer, as the ligand, when that interacts with the JAK receptor or the cashier, okay, the cashier will pass your order to the kitchen. Okay, so it's JAK telling the DNA, telling the genes,
Telling the kitchen what to
telling the kitchen
produce.
what to produce. Yes. So what are the food that gets produced when this gets activated? When the
Okay.
JAK-STAT pathway
What's
gets
on the
activated?
menu? What is
Yes.
available?
Okay, so these are the things that's on the menu. Quite a lot of things. Cellular proliferation, meaning cells divide.
Okay.
They multiply. So 1 becomes 2, 2 becomes 4, 4 becomes 8. Okay? Cellular differentiation or maturation. Okay? So imagine your young red blood cells being babies inside the bone marrow. Then they
become
mature.
adults.
They become adults so that they can carry oxygen and function properly for you. Okay? So that's another one. Another one is cellular migration or movement. Cells migrate, especially during baby when you're an embryo. Okay, so you're this small small embryo, right? Of course, how do you become a full fetus?
Yes.
Okay, cells migrate,
They
cells
move around.
mature, they move around.
Does this
Okay.
have an impact on cancer spreading?
Yes, especially metastasis and tumor invasion.
Okay.
Okay, cellular death is also known as apoptosis or programmed cell death. This is how, you know, when cells get old, or this is how they die. Okay.
So this naturally, and the
Yes.
issue about cancer cells is that cancer cells often don't die.
They don't
And then
die.
the healthy cells die, the
Yes.
cancer cells don't die.
So they just multiply and multiply and multiply. So when JAK-STAT pathway gets activated, cellular death gets reduced. Okay?
Oh, okay.
So next is cell survival. Cell survival is longer with this. So it is like cancer becomes stronger.
All right.
Okay?
Wow.
So next is the creation of blood cells. So you know this already. Immune cell development, stem cell maintenance. Okay, so human growth and development, as just what I have mentioned a while ago, and breast gland development. So these are the things that gets activated, that gets turned on when JAK-STAT is activated, or when you order in that counter.
But what happens in your illustration to a cancer patient? What happens when their JAK-STAT is overactive, when it
Yes.
produces too much?
This is what happens. So remember what I have mentioned a while ago? So the function of the JAK-STAT, you just enhance that. Okay, so increased cell proliferation. So your cells are multiplying excessively. Okay, so instead of 1 becoming 2, 1 becomes 4.
That makes the cancer cell grow faster.
Yes, that's why we develop tumors. Okay?
Wow.
Next is decreased cell death. Cells just live longer.
that is good for the good cells, but,
But
that's
bad
bad
for
news for
cancer
the
cells. Okay, so decreased immune function.
Oh, we don't want that.
We don't want that. It's
Yeah.
because why do we have decreased immune function? It's because the white blood cells are not matured properly. They don't mature properly. So if they don't mature properly, they don't function properly. So next is immune system evasion. It dodges the immune system. It evades detection by the immune system.
Wow, those
There's
are
also
very
one
serious
Okay.
impacts on cancer.
Yes. So next is tumor recurrence. That's why some of you who have undergone immune chemotherapy, radiation therapy, hormone therapy, surgery, one way or another, somewhere down the line, you develop recurrence. So these are one of the reasons. Okay. Tumor invasion. All of you already know this. Increased tumor blood supply formation.
Oh, that's bad. Because if you increase the tumor blood supply formation, the tumor grows
faster because they have their own supply of nutrients already.
Wow.
And the tumor deprives you of nutrients that the healthy
They,
cells
they
in your body
steal
should
from
have been.
the healthy
Yes,
cells.
it's like parasite. It's like
Yes.
a parasite.
And I see the next one is cell migration, and that's the most scary thing in cancer.
Metastasis.
Metastasis. You know, for our audience, it's important to take note that if your cancer does not spread, in many cases, you can live a very, very long time with the cancer in your body.
Yes.
In fact, most of the cancer deaths are a result of cancer spreading. If you could isolate your cancer, if it just only stays at one point, you can basically live with it. Which is why prostate cancer, in the early stages, doctors just sit back and
Observe.
just observe
Just observe.
because it's not moving anywhere. It's just one location. So stopping your cancer from spreading makes cancer less lethal. And that's something that you should aim to do if you're a cancer patient. So this is very important that we stop this.
Yes, correct. And one of the bad things as well is that the tumor itself can develop drug resistance. This is something
wow.
that Dr. Jimmy has been saying again and again.
Okay.
Some tumors develop resistance to chemotherapy.
Yes.
This is one of the reasons
Oh, because of the JAK-STAT.
because of the JAK-STAT. But for this, for the JAK-STAT, there are quite a lot, so we don't have time to enumerate
Yes.
all. I just give you one very common example that a lot of breast cancer patients are very familiar with. Aromatase inhibitors or letrozole, also known as anastrozole, and exemestane. Okay, for our breast cancer patients who are hormone receptor positive, this is one of the mainstay treatments that you will be undergoing. If JAK-STAT is overactivated, you develop resistance to these drugs.
That's not good.
That's not good.
Mm.
Okay, sometimes aromatase inhibitors are given for 5 years.
Okay.
Sometimes because of the sheer duration of the drug, the sheer duration of the number of days of the drug
You
that's
give
been
the
given.
chance for the
You give the chance
for the
for the
cancer
drug
to mutate and
mutate.
develop a defense
Yes.
against it.
And sometimes, at the back of your mind, hey, it's being given for 5 years. So, at the back of your mind, probably I have to be on it for a significant period of time for it to work.
Mm.
But sometimes along the way, we don't know that it's not working anymore.
Because the cancer has already mutated.
Yes, because and also because of this JAK-STAT pathway.
So for many cancer patients, I think this is one of the most traumatic experience and very confusing because the drug was working. My tumor was the size of like this. Now it's only so small. How come now it's growing big again? What happened?
Yes, and it's quite frustrating for a lot of cancer patients because you have spent so much money.
And you're starting to celebrate already. You are getting encouraged.
Yes, and then this happens to you. Sometimes you get smacked by smacked by life. Why did this happen? Everything I did was my onco told me everything I followed to the letter.
And it seemed to be working.
Yes. There's a solution to that. We'll go into that later. So now, what are the reasons why the JAK-STAT gets overactivated? Number one reason, inflammation. So I have shown you these two types of molecules, IL-6 and IL-22. So what are
What is
they?
this?
Okay, what is this? Remember COVID? Okay, remember the drug Remdesivir.
Yeah, I was about to say
Okay.
that.
Remdesivir is an IL-6 inhibitor.
Okay.
Okay? In COVID, IL-6 is one of the inflammatory factors that can kill a person. Okay? And this is exactly one of the reasons why JAK-STAT gets overactivated.
Because of the
presence of IL-6, because of inflammatory factors. Now, IL-6 and IL-22 are both pro-inflammatory, and these can get elevated for
many reasons.
For many reasons. And number one is lifestyle, the food that you eat. I've been reiterating this again and again and again. So please watch those videos. Okay.
Okay.
Now, next is inhibition of negative regulators. So what does this mean?
Okay.
So for every restaurant, you
Yeah.
have your security guard.
Okay, that's easy to understand.
Easy to understand. What does the security guard do?
Chase away the wrong people.
Chase away the wrong people. Also, they filter who comes in
Yeah.
the establishment.
Yeah.
Okay?
So they don't let the gangsters
Yes.
come into the restaurant.
So, this one, no, inhibition of negative regulators means that your security guard got sick and went for a sick leave. Okay? So, if you don't have a security guard in your establishment, all people will come into your establishment.
Doc,
Okay.
how does this happen to a person? Why would our security guards take leave?
Again, for a number of reasons. Usually, it's because of mutations. And
But mutations are part of life.
yes, however, in cells, mutations can correct themselves.
Wow.
However, there is also a mutation of a mutation, so
Okay.
that the corrector or
The person
The-
that is supposed to come
Yes.
and
Or
wake the guard
yes,
up, to
wake the
prevent him
guard
from
up,
sleeping,
or
actually doesn't do his job.
doesn't do his job, or the auditor doesn't do his or her job, okay, or does erroneous corrections, okay. So that is what happens. The approach should be holistic.
Yes.
Yes, so you should not be focusing on just one treatment alone. You should consider all the other treatments. Actually, as much as possible, combine them. Now, let's go to the solutions. Okay, so we have a lot of JAK inhibitors already. Drugs, no? That inhibits this interaction between the cashier and the customer. Cashier and customer. Okay? So, examples would be ruxolitinib, tofacitinib, fedratinib, peficitinib. Okay, so these drugs, I only chose one. Okay, the more common one here in the Philippines is ruxolitinib. And the problem with JAK inhibitors is that it's not readily available in the market, and it's quite expensive.
Okay.
This is the price, no? I got this from the DOH website.
Okay.
This is the price when this drug, the price of this drug in 2020.
Okay.
So, take a look at the prices. It's crazy expensive. One day, the lowest dose, one day you'll spend 4,000 pesos already.
Every day 4,000.
Yes. Yeah, and you know, for breast cancer, to use this drug, you need 25 milligrams.
Okay.
So that would be at least 10,000 pesos per day.
Wow. No wonder maybe this is the reason why it doesn't occur to
Yes.
the oncos, because
It's
it's a tool that they seldom use, because it's a tool that is not in the reach of many
yes,
people.
and it's quite expensive. And you know how long you should be on this? You should be on this until we see clinically significant improvement or your platelet count decreases. Then we adjust the dose.
Okay.
That is the time. But as long as it is working, you should be on this.
Is
Even-
there another solution than this?
Yes,
than this?
there is a
Oh.
cheaper one.
Okay.
So we have PPAR gamma agonists. PPAR gamma agonists are inhibitors of JAK.
Okay.
Okay, and
And?
they will be way cheaper. One example would be Simply Nature PPAR liquid.
And this is where my expertise comes in, because I'm familiar with PPAR gamma, and Simply Nature extracts and even our tablets are rich in PPAR gamma agonists. So yes, and I saw Doc, that you said in the previous slide that I can see, the audience may not be able to see, that these drugs work well with chemotherapy. For example, cisplatin. And I was thinking to myself, our Simply Nature liquid extracts actually remove or manage like a majority, maybe 60 to 80% of the side effects of chemotherapy drugs like cisplatin. So if you are a chemo patient, you should be already taking our product. Now the product also inhibits JAK-STAT.
Yes.
So that means that you kill two birds with one stone. So those of you who are already on Simply Nature PPAR protocol, look forward to your breast cancer treatment by your onco to be even more effective, or at least you can rest assured this problem of the JAK-STAT would unlikely happen to you because you're already taking something that modulates your JAK-STAT hyperactivity.
Yes. Actually, this is also one of the proofs that Simply Nature PPAR liquid really works in synergy with a lot of the conventional drug protocols used for cancer. Okay, so yes, if you are a cancer patient, you should really consider using Simply Nature PPAR agonist together with your chemotherapy, together with your hormone therapy, together with your immunotherapy or targeted therapy. Okay?
And with that, we hope we've achieved today give you a potential solution if you are one of those patients who can't understand why your therapy is not working for you or the results have decreased. So this JAK-STAT might be that key to your issue. And once again, from Simply Nature aspect, we always want to make sure that our audience, our patients, understand why and how the product is working for them. And over the last 2 years, we've always been adding to this body of knowledge so that you can feel confident that you are receiving treatment that makes sense, that is well researched, that is understood, both by your attending physicians like Dr. Jansen, from the support of chemo and cancer treatment to your oncologist. Because all these research is readily available. And if you want us to speak to your onco so that they can understand what you're going through with Dr. Jansen, just let Dr. Jansen know during the consult. Right? So without further ado, Doc, can we go? I can see many questions coming out. So let's go?
Yes, let's go to the Ask Me Anything portion already. So yeah, I can see a lot of questions already coming up.
Thank you so much, Sir Shyan and Dr. Jansen. I'm so sure that our viewers have learned so much from that discussion. We are now in the what we call AMA or Ask Me Anything portion. But first, before we go to the questions, I'd like to quickly greet our viewers for tonight. Starting up, of course, with our Miss Edna Aveo and Miss Helen Kamunayan. We also have viewers with Earl Halos, Laya Asuncion, Minda Banana, Marlene De Leon, Melinda Civil, Malu Baldomero, Annalisa Catalino. Thank you so much for joining us today. Should you have any questions, please? I can see a lot of questions are coming in now, so let's not keep you waiting. In this modern world filled with noise of different opinions, trust the ones from the experts. And to answer our questions for tonight, once again, I'd like to call on our health experts, our lifestyle integrative doctor and integrative oncology specialist, Dr. Jansen Kalalan, and our CEO and founding director of Simply Nature International and PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan. Good evening, Dr. Jansen. Sir Shyan, Dr. Jansen, may I just say that today is our 200th episode. Yeah.
Doc, thank you for this journey together. 200. Oh my God, there's only 54 weeks in a year. So that close to 4 years of almost every single week. I think we only missed one out of the 4 years. So wonderful. Thank you, Dr. Jansen. Thank you for our viewers, and thank you, Sheila, for this journey. Sheila, you're muted.
Apologies. I just want to, of course, say thank you to our viewers who've been supporting us all the way since pandemic time and made all of this a success. Thank you so much. All right. Shall we go to our first question for tonight? All right. Okay. So
let's do that.
All right. So for our first question coming from Ms. Marilu, is this product safe for breast cancer survivors? Wow.
We're using it for cancer support, supportive treatment for cancer therapies as an immune booster. Yeah, so it's safe for cancer patients.
Yeah, in fact, for cancer survivors, this is one of the very best natural supplements you can take, right? Number one, for the tablets, okay, so it depends on at what stage of a cancer survivor you are, right? If you just went into remission, you just finished your oncological protocols, then, for example, you finished chemotherapy last week or last month, then we will suggest that you go on 1 jar extract powder just to really boost your immune system, and after that maintain with soft gels and tablets. All right. So if you have already survived cancer, you passed the 5-year mark, right? Then I would then suggest either soft gel or tablets. And if you really have you have survived cancer, maybe it was 6 years ago, 7 years ago, then I would suggest the tablets. Now, the wonderful thing why it's ideal for cancer survivors is number one, the PPAR tablets alone will already help you manage your metabolic syndromes. So your high blood cholesterol, your high blood sugar, or hypertension, general inflammation, right? Chronic inflammation, all this will actually be managed by your by Simply Nature PPAR tablets. And these are factors that affect recurrence and development of cancer in the first place. So not only are you able to take something that's anti-cancer, because that's a very broad term, but in a very real sense, it will help you manage all the factors that cause cancer to develop, and of course the issue of reoccurrence for a cancer survivor. So yes, it's really one of the best things that you can take naturally. Yeah.
I just have a very, very quick question because it's also like a follow-up also. Is Cleansing Plus also ideal to be part of the protocol for cancer survivors?
Doc, you
The
want to
answer
take this?
is yeah. The answer is yes. So remember for those who are watching us regularly, I'm sure you've heard us talk about hallmarks of cancer. We actually have a video about the 10 hallmarks of cancer. We have an update. It's now 14. Yeah, it's now 14 hallmarks. Now, one of the hallmarks is has something to do with your microbiota. There are we call this a polymorphic microbiome. So the microbiome is basically your gut bacteria. Okay, so the gut bacteria, there are different species of bacteria there. So it's a population of different bacteria. So if the population is I'll rephrase that. No, there is a composition of your gut microbiota that if certain bacteria are high compared to the others, or their unique species found in your gut microbiota, you have a higher propensity to develop cancer. Yeah, so it's part. So the gut microbiota is part of the 10 hallmarks of cancer. Now, how does fiber or cleansing plus come into play here? Fiber in general, no, would be able to nurture the good bacteria inside your colon. So when we talk about good bacteria, these bacteria reduce your risk of developing cancer. How? By promoting anti-inflammatory substances. These gut microbiota also has rules in making sure your immune system is working properly. Okay, so if you these kinds of bacteria, we usually see that in patients who have high intake of fiber. Okay, and the fiber also feeds these good bacteria. Okay, so if you are someone who is not fond of vegetables, who's not fond of eating plant foods, then just by taking Cleansing Plus, you would be able to increase your fiber intake and make sure that the remaining few populations of good bacteria inside your gut would be fed properly. Okay, so this is, in other words, so this is your first step towards living a healthy lifestyle, or being healthy, in other words, no? So, what is it in Cleansing Plus? What ingredient in Cleansing Plus would do this? It's the psyllium husk. Psyllium husk is a fiber. However, here's the thing, no? Cleansing Plus is still a supplement. Okay? Ultimately, the fiber that you want should be coming from plant foods because plant foods have different kinds of fiber. Okay? But of course, no, behaviors take time to change, habits take time to change. Okay? So while you are on the process of changing your lifestyle, you have cleansing plus to immediately increase your fiber your fiber intake, so you immediately get you immediately begin to experience the benefits while you're still doing implementing the necessary lifestyle changes. Okay, so that's the value of cleansing plus. And of course, no, it's always a relief to be able to relieve every single day.
Yeah, of course.
Okay,
Of
yeah.
course, it affects our moods. Thank you, Sir Sean. Thank you, Dr. Jansen. Amazing tips for our cancer survivors, and congratulations, by the way. All right, I just want to read a very good, amazing sharing from our comments coming from Miss Louis Christine. I've been taking PPAR since December. Started with powder, then now on soft gel and tablets. Diagnosed with stage 3A breast cancer. It's my first day of chemo today. I feel normal and no side effects. Thank you, Lord. I told my uncle about taking PPARS, but she said to stop during the entire treatment. But I'm afraid I'll have to have the side effects in my next session, taking AC dose protocol.
Okay.
Yeah,
Doc, you let me
okay,
answer
okay,
this
okay,
first because
okay.
I don't want you to comment about your colleagues. All right. Okay.
Okay. Go ahead, go ahead.
Actually, for Miss Louise, so good, wonderful results. You don't feel any of the side effects from chemotherapy. Okay, I'm going to help you because I just had a conversation with a client today about their experiences and difficulties. Like, why would your uncle tell you to stop taking PPARS? All right, so I will let you know why. Because they don't know what it is. Okay, they don't know what it is. So first of all, don't be upset with your uncle, because I was talking to a friend today. He was very frustrated with his experience with a doctor. All right, so I helped him understand. But then, as we discussed, he also agreed doctors are also have their hands tied. Hey, why? Hospitals are at risk of lawsuits for being sued for malpractice, for all that. And because of that, there are very strict guidelines for a doctor. Okay, so they are also acting to protect themselves and the hospital. So anything that they're not familiar with, they will tell you not to take it. Okay, and if you insist on taking something, and let's say you are in ICU and you want to take a particular thing, in the worst case scenario, when the doctor when you really insist, the doctor will ask you to sign a waiver, which means they are not responsible for any effects that come from whatever you take. So the reasonings behind this is very simple. There are also things that your doctor is very concerned about because he doesn't know. Because the answer is really because he is not familiar with it, and the hospitals and clinics and practice has very clear guidelines for what the doctor should say. So if they don't know, they'll tell the patient not to take it. So one way you can really check is you can check your doctor's reaction. If you ask the doctor more, Doc, are you familiar with PPARS? Do you know what they are and how they can help with cancer? If they look at you like, just don't take it, it means that they're not familiar with it. They don't know. So they're going to give you the safest answer according to their guidelines, which is not to take anything that they don't know. Because they're not sure if the PPARS will conflict with chemotherapy, the therapy that they're giving you, right? They didn't read the literature that Dr. Jansen has read, Dr. Jimmy, and all other doctors that use PPARS with chemotherapy, right? They haven't read that, so they won't know. If they don't know, they have a clear guideline what they should tell you, which is don't take anything because it might interfere with chemotherapy that they're giving you. So today, we are able to tell you that no, it will not conflict with your chemotherapy. There are oncologists that use our products. In fact, the good news, update for Dr. Jansen as well. I think our PPARS is now available in which hospital? The Chinese what's that? Which is the famous one? It slips my mind right now. But basically, we are, huh?
Sorry,
Sheila?
Cardinal, Chinese Jhen.
Yeah, I think one of them. But within the next 6 months, we're actually going to be found in the pharmacies of all the major hospitals, right? So it's part and parcel of the process. When it is now available at the pharmacy of like General Santos, Chinese Hospital, and all that, then the oncos will be more comfortable. Okay. Now, if you really, really want, and we'll be happy if you give us the hospital and name of your uncle, we actually have medical representatives that will go then and explain. We won't tell them that you sent us, okay? But if you just highlight to us so that we can go and approach. Right now, our team is systematically approaching, and we are going to join more oncology conventions. So by the end of the year, hopefully your doctor will be familiar with us. Okay. Now, if you always want, Dr. Jansen is very experienced. Dr. Jimmy is actually a surgical oncologist. So yeah, he uses chemotherapy and he uses Simply Nature PPARS to support. So I just want to give you the assurance, and don't be angry with your doctor. He or she is just following their guidelines. So until they are familiar with PPARS, this will be the response. However, I did talk to my friend today, and we were discussing one thing, and maybe Dr. Jansen as a doctor can say something about it, especially as an integrative doctor, right? Which is, I highlighted that every doctor seems to be defending their position, right? So for example, a physiotherapist would say that acupuncture doesn't work. Acupuncturist will say that a physiotherapist is not as good as acupuncture. There's a tendency for every specialist to defend their position, all right? And it is important, right, that patients have to understand one thing. It's a step of courage also, that you have to make the effort to learn about the protocols you're taking, right? So there's a difference, right? If you know about PPARS and how it works, and your uncle doesn't know about PPARS and how it works, then it makes common sense that they will tell you not to take it because they don't know how it works, right? However, if you know, then you can make the decision. And of course, that's why we have a program like this. We have open forums like this so that you can hear from other doctors, right? Doc Jimmy is a specialist. Dr. Johan is a full-fledged medical doctor, but he uses lifestyle diets and natural foods to support. Dr. Jansen is such an expert in integrative medicine in the area of supporting cancer patients. So these are all qualified opinions. So this is why, to give you the confidence and to be able to answer your questions specifically. All right. So we have to take responsibility, because in the end of the day, as a patient, it is not your concern about which specialist is correct. What your concern is, are you getting the best option for your treatment for cancer? So that is why that is very, very important for every patient, right? You got to remember that the doctors are defending their viewpoints, but in the defense of their viewpoint, you may not be getting the best combination, right? You may not get the best combination. So as a patient, you are not involved in the politics of which specialization is correct or wrong. You are in your interest to find out which one works, right? Which one works and which one works well for you. And in that process, of course, be evidence-based. You must understand, make sure it makes sense. Test the person that's giving you the information. Do they know what they're talking about? If they say something is not good, do they even know what that thing is? If they don't know, then their opinion is not factual. They're just playing it safe, right? Or just instead of saying I don't know, they say don't. Okay, so I think that is little tips where you can learn to make your own decision. Again, what I say is, don't be upset with your doctors. They all have your best interests at heart as well. It's just that we are all operating on different levels of exposure and understanding. For example, if you ask a particular onco about a drug and you don't tell them it's a chemo drug, but you just name a new drug that's maybe experimental, they might tell you, oh, don't take that drug, take the chemo that I'm going to give you, because they're not aware of the new novel chemotherapy drug, right? Unless they read the literature and they read the details, they will tell you, don't take that, take the one that I'm familiar with, that I know works for my patients in the past, and that's the best option for you. But again, that may not be true, right? There may be a new chemo drug that only the best oncos in Philippines know about, right? Because they are the first ones to use it. So with this, I hope you understand and helps you make how shall we say, you feel more confident in making your decision. All right, Doc.
Yeah, everything that you said about this is true. So that's the challenge of integrative medicine doctors. No, actually, not just integrative medicine doctors. Every other doctor, regardless of specialty, um, interacting with other doctors, no, and other doctors interfering or staying or saying that, hey, you shouldn't take this while doing this, or yeah, changing the prescription or whatnot, no, it's because of the lack of, it's usually the lack of education. So I mean, you can't blame them because it's not their area to study in the first place. I mean, why would they uh, get more knowledge about this when they're already doing something important for the patient, and that's what they do. Okay, so it's not just true in the field of oncology; it's also true for other specialties. I mean, I have first-hand experience when I was a student rotating inside the hospital. I mean, our role, as students, as trainees, our role is to learn, and to learn. No? So we learn from our patients by reading the chart, asking doctors questions, our attendings. And sometimes, though, we have they are in this kind of situation wherein they fight on paper. Anyway. That's
Internal.
behind the scenes experience. No? So right now, going back to the question of the viewer, another concern about your onco saying that hey, you don't take anything during the chemotherapy is because of concerns that other supplements or other ingredient substances that might interfere with how the chemotherapy works with the body. So it's a question of efficacy or maintaining efficacy, which is actually a valid concern. Yeah. Okay. So in my practice, so as not to cause any conflicts with other doctors, so I just tell the patient, let's just follow what your onco wants. I mean, there's nothing to lose there. I mean, you've been on PPARS for long enough already. Your immune system won't just tank down because you just skipped one day of taking PPARS. No. So that's why I am okay to just come on. Let's just follow your onco so as not to create any conflicts. Now, in theory, can you really take PPARS together with the chemo? The answer is yes. There are actually certain chemotherapies that even work in synergy with PPAR agonists. Okay, so in synergy, what does it mean? It means that it enhances the effect of the other. It makes the effect of the other more effective. Okay, so we have this, but of course, so if you have already this kind of concern from your onco, let's just give the onco due respect. We follow. Okay, rest assured, the side effects would still be managed because I mean you just skip taking PPARS just for the day you receive the chemo. The following day you can begin taking again, so that's fine.
Sir Shyan, you're on mute.
Yeah, so just as Dr. Jansen say, so to give your onco respect, right? On the day that you do your chemo treatment, don't take PPARS, all right? And if you understand how chemotherapy works also, there is effective time that the chemotherapy is working. So if you are taking chemotherapy now and then your next session is at 2 weeks later, the effect of your chemotherapy will be over actually within 72 hours. Right? Within the first 24 hours, most of the effect of your chemotherapy is already done. So it's like The chemotherapy attacks the cancer and then you let your body rest for a certain period of time before you take another dose of the chemotherapy. This is for intravenous chemotherapy, for example. All right. So actually, by waiting one day, on the day that you are doing your chemo, you don't take the PPARS, it's absolutely fine. You wait 24 hours, the next day, most of the effect of the chemotherapy is already over. So now it's time for your body to repair itself and to get back stronger so that you're ready for the next dose. So that is why Dr. Jansen says, yeah, it's okay. Just let the onco be comfortable. So then you can honestly also tell the onco, oh yeah, when I was doing the chemotherapy, I didn't take anything. It was just your chemotherapy. Now, after the effects of the chemotherapy is done, which is 24 hours to 48 hours, then your body is actually ready to receive other things as well. All right, so that's the advice, both from Dr. Jansen and myself, and I hope that also helps everybody out there understand. And everybody keep your fingers crossed, right? Hopefully this year our med rep will actually talk to your uncle, and then next year it will be your uncle that asks you, did you take PPARS together with all right, so we are heading towards that direction. So we're all hopeful for that. Okay, I hope that helps you.
Thank you. Thank you, Sir Sean. Thank you, Dr. Chance. On the perspective of patients, I just want to say that we are so blessed to have doctors like Dr. Jansen who really takes time to study about PPARS and tries it first before they recommend it to their patients. So thank you, Dr. Jansen.
I just want to let everybody know, I know Dr. Jansen for 4 years. It took some time before he said yes to PPARS, right? He went to research and then he tried with the most serious patients where there's nothing else they can do so that to minimize the risk. He went about it in a very systematic way. I think it took almost 2 years before Dr. Jansen was fully on, right? So even if Dr. Jansen, who today is so convicted and so confident, imagine he took almost 1.5, 2 years before he was fully convinced. So don't be too upset with your uncle, all right? And yeah, so it will take him time as well. But we'll get there. But at least right now, you really have you can get confidence because we're always here to answer questions. The resource is available to you, all right?
Yes, Dr. Jansen is not easy to get. Okay, all right. Next question coming, and I can see a lot of questions are lining up. All right, it's a busy day tonight. Coming from Ms. Richelle from California with breast cancer stage 4 metastasized to the spinal. I had yes, I had my spinal tumor removed last January 15 and had my radiation once after the surgery, but no chemo. What is the best time to take the PPARS liquid vial if I also take anastrozole 1 milligram once daily, 10 a.m. and Cascali 3 times daily?
Yeah, so PPARS liquid, take it orally, you drink it. It's best taken an hour before or 2 hours after you eat. Yeah. So just make sure that you separate it from your other medications. Take it separate from the other ones, no? So you can take it basically it's on an empty stomach. So make sure your stomach is empty. How do you know if your stomach is empty? You take it an hour before or 2 hours after eating. Yeah, so probably if you can even prolong, no, at least 2 hours after, 3 hours, 4 hours, that would be better. Anyway, it's just once a day, so.
So, Doc, would you advise that this particular patient, like for example, when she wakes up, empty stomach, before any breakfast or anything, take the liquid and then 1 hour later proceed with the breakfast and proceed with her other medication as well? Yeah.
Yes. That would be a good way to do it. If you're taking already plenty of medications, no, in the morning, then you can take PPARS liquid just before you go to sleep.
That's also not possible. No, I just want to ask, just out of curiosity, are most oral chemotherapy drugs taken after food?
Usually, yeah. This is to prevent stomach upset.
Yeah, because I would assume that chemotherapy drugs are very strong. I mean, in general, they in terms of all drugs, they are the drugs that actually have, I would say, more attack power, in the layman terms. So you would want to buffer it by not letting it just hit your GI without any food or anything to sort of like dampen the impact, right? Yeah. So usually taken after food. So that means it's a great way to take the liquid before food, then you eat food, and then you take your chemotherapy drugs, right? So that would be a good timing. Yeah.
Thank you, sir. Thank you, Dr. Jansen. All right, two questions are related from Ms. Lizelle and Ms. Maria Fe. Can PPARS help in shrinking the breast mass? I'd like to think this, it wasn't mentioned if it's benign or cancerous, but I'd like to think that this is from a perspective of no biopsy yet and just detected breast mass.
Yeah. Okay, depends on if your breast mass is malignant or benign, no? But for benign breast mass or any benign tumors, usually PPARS can help shrink it. Okay. We have personally seen, I have patients where in a benign mass, no, we were able to shrink a benign mass, okay, with PPARS. Um, if it is a malignancy, it can as well. However, it would only be for early stage cancers. However, for that matter, if you are on early stage cancer, no, early stage, it would still be best for you not to rely only on PPARS or any single supplement or treatment. Make sure you utilize as much as possible multiple different kinds of medications, natural extracts, and if you have a mass, if it is resectable, have it removed. Okay. Now the question of going to surgery, um, this question we would be able to answer depending on the characteristics of the tumor, if it is benign or malignant, the size as well. Yeah. Okay, so to answer all of these, you need to see a doctor, and necessary laboratory tests have to be done. Yeah. Okay.
So for this particular viewer, I would advise you, my advice or my input or for your consideration and for you to understand is PPAR would help with shrinking mass, right? So it's something that you can start today, right? It's something that you can call up, leave a message, talk to Sheila, talk to our HCS or CSOs, HCS if you want to have an appointment with Dr. Jansen. So it's something that you can do today or tomorrow, right? You can start on it. And then what Dr. Jansen says is so true, especially if it's malignant. That means it's cancerous. Don't stop there, right? Go and have an appointment with Dr. Jansen, find out what else you can do, right, to increase your chance of success. So even though Simply Nature PPARS is very effective for supporting cancer treatment and for actually managing cancer, it is my firm belief, and Dr. Jansen's also, the approach to treating cancer is not one. Dr. Jansen just said there are 14 gateways to cancer, right? So why attack it from only one gate when you can actually attack it from the 14 different angles? Okay, but what the good news is, even before you make an appointment and to explore more things, there's already something that is so safe, good for you, and effective that you can start right away. So cancer is always a fight against time. So while you're deciding what is the next thing you can do to cancer, you can already do something positive that will help your quality of life, prepare you for other protocols. Just like our first viewer, she prepared herself for chemotherapy with Simply Nature PPARS. Then when she took chemotherapy, there is no side effect. She feels good. See? So whether or not you're going to go for chemotherapy, you can already do something to get you on the right track. And I would advise you, especially, actually, whether you want to go for chemotherapy or not, I would advise you, if your issue is a malignant tumor, which is cancer, make appointment with Dr. Jansen, all right? Because he can actually answer any questions you may have about chemotherapy. And he is so well versed in other modalities, from vitamin C drip to nutritional supplementation, lifestyle adjustment, all this to support whatever choice, whether natural or convention, that you want to adopt for your fight against cancer. And now Dr. Jansen he even explored understanding TCM. So now he can even incorporate things like acupuncture advice to manage the pain part of whatever chemotherapy or whatever treatment you may get. So he's like a wonderful, all round. You can ask him almost anything. Okay. So I have a consult, and I know Dr. Jansen. I think just last year he went to Taiwan, right, to learn about new stuff again. So so it's really wonderful. Not everything that Dr. Jansen explores, he actually uses. But I really respect Dr. Jansen because even though he's not practicing acupuncture, he went to understand and study about acupuncture, get the basics, so that he will understand how it could help and interfere or work together with cancer or cancer treatment. So that's what a wonderful resource. All right. Yeah.
That is why, for those of you who wish to have a consult with Dr. Jansen Kalalan, you may just type in how to consult. Our caring HCS, Ms. Beth and Ms. Irish will definitely get in touch with you immediately. Thank you.
Yeah, and to our viewer from California, this is wonderful. You don't have to come to where we are. You can, from California, have a consult with Dr. Jansen. It's just that you will have to either wake up very early or stay up very late to match our time zone. All right.
That's right. Thank you. Thank you, Sir Shyan. Thank you, Dr. Jansen. All right, I just want to greet our viewer from YouTube because we're simultaneously playing there as well. Miss Raniesa Amadio, thank you for question. So question is, what product is best for hemorrhoids and heart concerns?
Hemorrhoids and heart concerns. Hemorrhoids depends on how big the hemorrhoids are. But in general, for hemorrhoids, you have to soften up your stool. So that would be cleansing plus in the tablets. Okay, for heart condition, depending on how severe it is, it's gonna be soft gel and the tablets. Yeah, if your digestion is really bad, then cleansing plus will come in. Okay, so that's the protocol. If for the PPARS, of course there will be others as well, depending on your situation. Okay, yeah.
Perfect answer.
Thank you, Doc. Next question coming from Ms. Rosaline Cabilos. I'm stage 3 breast cancer and taking PPARS powder and PPARS plus tablet preparation for chemotherapy. Is it okay to take powder or much better to take PPARS liquid? That's the question.
Okay. The factor for this is your financial capacity.
Yeah.
The best is to take liquid for any stage of cancer, okay, regardless if you're going for the chemo. Now, of course, the liquid is gonna be more expensive than the powder, no? So if you can afford it, then that's the way to go. But if not, then you can go to the powder instead. Okay. So best way to approach that. No, in terms of efficacy, the powder would still work, but a little bit less compared to the liquid. Now, are there any situation wherein the powder trumps the liquid? Yes, there are. There are. Okay. One such example would be nausea. If you have nausea and vomiting, don't take the liquid, or else you're gonna be vomiting expensive vomit. Okay. It will cost powder. Okay, so just take the powder so as not to, so it will just dissolve in your mouth like candy. Yeah.
I wonder. That was a very interesting point about the powder and nausea. One thing I want to highlight in cancer treatment, sustainability is important, right? You don't want to find something that works and then you can't continue. Okay, so I want you, to all the viewers out there who are exploring PPAR protocols, I want to encourage you to be frank and honest with your with whoever is supporting you, right? Either the HCS after your consult with Dr. Jansen or when you're talking to one of the CSOs. Don't be shy, right? Cancer is a very expensive disease to treat. All right. So it's okay to say, you need to manage your finances. We totally understand, right? And cancer treatment is not 1 month, 2 months, huh? It is a prolonged period. And after everything is clear, you still have to cross the 5-year mark. So during that that year 3, year 4, year 5, it doesn't mean you do nothing. It doesn't mean you don't have to take any supplements or any treatment protocols, right? There are still expenses all the way to the 5-year mark. And then only after the 5-year mark will your expenses of keeping a healthy life really come down to a very normal level, like a normal person. So planning out the finances is an important part of the whole process. And don't worry, we have be assured we have patients who do very well on regardless of the budget. Okay, so how do we mitigate if you have a tighter budget, right? If you have a tighter budget, then you need to have a more disciplined life. Okay, that means you make more effort about the diet, the lifestyle. That part can help in your recovery. Okay, and help in your fight against cancer. Okay, yeah.
Thank you. Thank you, Sir Sean. Thank you, Dr. Jansen. I just want to greet another viewer from YouTube channel, Bobby Fisher and Aldrin Beltran. Thank you. Thank you so much for watching us tonight. Okay, on a lighter
Bobby
note.
Fisher from the US. I know Bobby. All right. I think I know this is the Bobby that I think I know. Okay, yeah.
All right. But once again, thank you for watching us tonight. On a lighter note, about Cleansing Plus, from Jean Lagman, the question is how to take Cleansing Plus. Is it before or after breakfast? What's the best time?
Very good question. Depends on what outcome you want to achieve. If you want to,
Okay.
yeah. If you want to do it for weight loss, best to drink it in the morning with breakfast, because that's going to make you feel full throughout the day. So you don't eat so much. Okay, that's gonna control cravings. Now, if you just want to address constipation, you can take it at night. Yeah, after with your dinner. Okay, so you poo the following morning.
Oh, Sir Sean, you're on mute. Okay.
I want to give this advice to people. Okay, Cleansing Plus is quite on the dot, right? For me, 8 hours later, you will want to find a CR. Okay, so for those of us who are taking for weight loss, I'm going to try this, because I've always taken Cleansing Plus like before I sleep. All right, so I'm going to try taking it in the morning because I want to experience some additional weight loss. So curbing the craving for food, feeling full is going to be a great part of the thing, right? But to all those who are also going to do this, please, if you take it at 7 a.m., right, plus 5 hours, that means somewhere around 3 to 4 p.m., you might really need to find a CR. And if you actually have an important meeting at 3 p.m., okay, it's not going to be a good situation. Or if you're driving, right, on the way to the yeah, so please take note of this, all right? So let's give it a range between 6 hours to 10 hours, that whole range, you might really feel a very strong urge to go to the CR. It's not like you will suddenly LBM and then embarrass yourself, but you'll be able to hold it in, but it's going to be tough. But it's sufficient time for you to find a CR, right? It's not like you cannot control. But do take note of that, okay? So that we don't have anybody complain, hey, I took the Cleansing Plus and it was very inconvenient. Okay, so take note of that. Yeah.
So, Doc Johnson, just to clarify, for cancer patients or whatever cancer, the best time is still nighttime or before bedtime?
For cancer patients, I choose morning.
Oh,
I choose morning. Yeah. The reason is it's during daytime that you eat. Yeah, and the fiber, the role of the fiber there would be to control whatever toxins you just ate. Okay, and of course that would also feed your gut microbiota. So the role of fiber here is nutritional in purpose. So when you're awake, that's the time your body feeds. So that's that's the best time to drink the Cleansing Plus. The only time I would consider drinking it at night is if you have a very fast bowel movement. So if you drink cleansing plus, you immediately go to the CR a few hours later. So that would be quite a hassle if you're working. Say, for example, you're working.
Mhm.
Yeah. But if you're a cancer patient who's just at home, best to
Yeah.
take it during daytime. Yeah, especially with big meals, especially with meals. Yeah.
Well, thank you, Tom Johnson. This is something I'm learning, and I'm gonna definitely experiment with it too and experience it firsthand. Okay, yeah, very 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 good tip. And Dr. Johnson made it very clear. It's very interesting because I know Dr. Johnson, right? We want to feed our gut microbiome because our gut microbiome is involved in the production of our immune system components. So we are actually maturing our immune system and effectiveness of our immune system in our gut. So you're actually using Cleansing Plus as a direct feeding or maturing of the immune system via the gut. So that's a very, very, to me today, is a very novel and very interesting tweak to improve efficacy and efficiency in fighting cancer. Wow, very, very interesting. Yeah.
I agree. I've learned so much as well. Thank you, Dr. Jensen. All right, coming from Miss Lillian Ramos, question is I'm a breast cancer patient and currently on hormone therapy. What's the best PPARS for me? Hormone therapy.
The decision on what kind of PPARs you're taking is not dependent on the hormone therapy per se. It depends on your health status. Yeah, it depends on your health status. So the answer would be if you can afford it, go for the liquid. Okay. But if you are financially, constrained, then what I would suggest, if you are just concerned with if you just want immune support, okay, and if you just want immune support, you can go for tablets and the soft gel. Yeah, if you want, you know, if you want
Foundation.
powder, you can use powder if you want a balance between efficacy and affordability.
Yeah.
Yeah. Okay. Yeah, you can go for the powder instead.
Thank you. Okay, thank you, Doc. Thank you, sir. All right, another, I just want to read some few comments here coming from Ms. Susan Lalugon. Thank you, Doc Jansen, for all your explanation. I'm now undergoing my targeted chemotherapy. Another comment from Arlene Columbano. Hi, right now I'm using PPARS also. I took 6 pieces of powder PPARS since 2023, started September, but there's no question. You might want to follow it up if you have any questions.
I think that in itself is a good commentary. Because a cancer patient in 2023, today is 2025. So that's already a wonderful statement. Yeah.
I agree. Okay, next question. Thank you, sir. From Ms. Mapresila Ocfemia, how to take PPAR if I have breast cancer, but I'm already well, and I just want to prevent recurrence. I like this patient, very vigilant.
Yeah. So if you just want recurrence prevention, then the focus there is on your health already. So tablets would be enough. However, here's the thing. For recurrence prevention, it is always a good idea to measure if there are any circulating tumor cells inside your body. So if you're in remission, the assumption is you are negative on your imaging. Imaging studies come out negative. So if imaging comes out negative, we would still want to find out if there are any nodules that was not detected by the imaging because they're still too small. Okay, or if there are any circulating tumor cells around your body. So circulating tumor cells are cells that's separated from the main tumor. Okay, we can measure that. How? Through liquid biopsy. So liquid biopsy, the sample there is just your blood. So we can send that to a laboratory. The laboratory measures the circulating tumor cells and find out the phenotype. So by phenotype, it means characteristics of the cancer cell. We can find out if the CTCs, the circulating tumor cells have a propensity to metastasize. We can also find out if the circulating tumor cells have cancer stem cell-like characteristics. Okay, so cancer stem cells are stem cells that produces other cancer cells. And cancer stem cell, like cancer cells, also have the propensity to invade and metastasize. Okay, so if you are positive with cancer cell, with CTCs, no, we have to find out if your immune system is able to fight them off. So there's another test for that. Okay. Now the immune system has different components. You have your adaptive and your innate immune system. So this by adaptive and innate, no, the innate immune system are the ones that you see in your complete blood count. So when you get your complete blood count or your CBC, the WBCs there, the white blood cells, below that white blood cell are your neutrophils, lymphocytes, basophils, monocytes, eosinophils. Those types of white blood cells are part of your innate immunity. The adaptive immunity are your T cells, B cells, antibodies. Okay, so we have to find out if your immune system is able to fight them off. Because if not, then we have to either boost your immune system. We have to know what the supplements are. Another one is to reduce cancer stem cell-like properties. So we have natural extracts for that as well. Now I remember Simply Nature PPARS. I just don't know which product it was. I think it was the liquid. Your product was submitted to a genetic testing laboratory.
Yes.
Yeah. So that
Oncological.
genetic, yeah. That I remember that the company, it's RGCC. So RGCC,
Yes.
that's also the laboratory that I use for measuring CTCs. I think they were able to measure the cancer killing capacity of PPARS liquid, and it does induce apoptosis.
Yes.
Yeah.
Correct.
So
Which means natural dying of.
yeah. And of course, dendritic cells are also important. Dendritic cells is part of your innate immunity. Dendritic cells also, the bridge between the innate and the adaptive is the dendritic cells. So the dendritic cells are like scouts. They get they get antigens. I'll rephrase. No, they get samples of your cancer cells, then present it to the adaptive immunity. Okay, so the adaptive immunity creates antibodies for the against the cancer cell. So studies have also shown that Simply Nature PPARS can increase the amount of dendritic cells that you have. So Simply Nature PPARS would definitely be part of the immune boosting protocol. The part of your protocol that would boost the immune system. Now you need the other one. Okay, you need to suppress cancer stem cell-like activity in order to achieve, in order to prevent recurrence and eventually bring down the number of circulating tumor cells inside your body. Yeah. So,
one thing really good about what Dr. Johnson just shared is that there is a tool, there is something you can do now that you are in remission or you have already stopped your oncological, how shall we say, any treatments, and it's been 1 or 2 years and you don't know how are things going, is my cancer going to come back or am I doing well? You want a peace of mind, right? You want a peace of mind. There's actually something you can do. So you can do the liquid biopsy to check your circulating tumor count. So that you can sleep at peace. You can do something, right, to check. Because if not, you are wondering, or if you have survived cancer for 6 years, 7 years, then now you're thinking, I don't need to go back for the CT scans anymore, right? Is there anything else I can do to check? Right, because all my scans come out negative. Because for CT scans, you need your cancer needs to develop to a certain stage before, before it can be detected. So the circulating tumor count is a good way to say, I don't have cancer, but my circulating tumor count, there is presence over there. I can do something to step up my immune system to bring this down, to really reduce the risk of recurrence. So it's like, am I, just to clarify with Dr. Jansen, so it's possible that your CTC is slightly elevated, but yet if you go for CT scan, everything is negative. So it's
Correct.
okay, so
Correct.
that is
Correct.
the best sweet spot for all cancer survivors, right? Before your cancer can really come back, but yet there is traces of it. It won't show in your CT scan, but it will show in the circulating tumor count. You can do something and nip it in the bud so that the recurrence doesn't actually happen. So that's a really wonderful new thing that Dr. Jansen is introducing. That's something you can do for all cancer survivors.
Thank you, Sir Shyan. Thank you, Dr. Jansen. Okay, next question is very interesting. I have to translate it. So coming from Ms. Chad Pacheco, question is, Doc, 11 years ago, I've had endoscopy and consistently on checkup. It was said to be colonoscopy gastritis and IBS. I was on consistent checkup, however, it wasn't resolved. So I did not went back to the doctor. I did not go back to the doctor. I just had I resorted to natural herbals. I've researched something that might be my condition, which is and I just want to know if there's such a thing as Valentino's syndrome, because ever since my right side has been aching, and when I do my bowel movements, I feel weakened. I've had my whole abdomen ultrasound with 3 contrasts, and it turned out normal. What's the best for me? A recommendation?
Yeah, Valentino syndrome is very rare. It's also very serious, no? So, Valentino syndrome is a medical condition where a perforated peptic ulcer presents with right lower quadrant abdominal pain, which mimics acute appendicitis. So, okay, so why is this very interesting? Okay, your stomach is located at the just above your belly button, okay, just above the umbilicus. So that usually a peptic ulcer will present as pain at that area. Okay, so that area is also just below your sternum. Yeah, so that area. Okay. Now, acute appendicitis is abdominal pain that is more focused on the right lower quadrant of your abdomen. Okay, right lower quadrant. Right? So it is very unusual for if for a peptic ulcer disease, no, a gastric ulcer to present as right lower abdominal quadrant pain. The location is just too far. Okay. However, here's Valentino syndrome, wherein the perforated peptic ulcer presented as right lower abdominal quadrant pain. Now, Valentino syndrome is also has symptoms that is very much centered around inflammation. So definitely, Simply Nature PPARS would be able to help with your condition. The beauty of this is the PPAR tablets also acts as fiber. It also acts as a food for your gut microbiota. So the gut microbiota would also be able to control any inflammatory factors that's ongoing in your digestive system. Now, of course, no, it's the solution here is not just PPARS. Ultimately, we have to treat the ulceration. Okay, that ulceration has to heal. All right. The problem here is perforation. So if your stomach is perforated, there is a hole inside your stomach, then it would be quite dangerous for you to eat food because the food can spill out of your stomach and go inside the abdominal cavity, which can cause peritonitis, which is an even more dangerous situation to be in. So ultimately, that perforated ulcer has to be sealed immediately. Okay? Now, to seal this, no, you need surgery. Now, if Valentino syndrome is actually if you have a confirmed Valentino syndrome, okay, then it is a must that you don't eat, okay? Avoid oral intake of food. Go see your doctor immediately, a surgeon, to confirm the diagnosis. Because again, a perforated stomach is dangerous because stomach acids will also spill out of the stomach and cause inflammation of your peritoneum, which is an emergency case, no? Because that can be you can suffer from an infection, eventually go into sepsis and die from it. Right? So my suggestion, my advice is go see your doctor. Yeah. First off, go see a gastroenterologist. Yeah.
Thank you, Dr. Jansen. Well, while you were explaining things, I was imagining animation of stomach in my mind. And it was pretty clear everything that you said. Thank you, Dr. S. All right. Would you like to add anything, Sir Shyan, or shall we move to the next question? Okay. Oh, you're on mute. Okay. All right. Okay. Next question coming from Ms.
Sorry. I wanted to say something.
Okay.
Because I noticed this thing happen on our chat a few times. I noticed there are viewers who then who are recommending like doctors and things like that. Right. So if ever our team removes such endorsements, it's nothing personal. Please understand, right? In this program, we are trying to give advice to credible advice to our viewers. So some viewers might mistaken any links or referrals has Dr. Jansen and my endorsement. So that's why I want to speak to anybody who posts like their own they want to refer or they want to recommend some other doctors online. We're not being rude or anything. It's just that we don't want our other viewers to think that we already did the research and we are endorsing your recommendation. So that's not fair to Dr. Jansen, especially he's a medical doctor, right? So his credibility is very important. So I want to make a request to all viewers. You may be very excited with your herbalist or whatever, but don't use our platform to do that. All right, it's not correct. We don't want to mislead viewers because every advice that me and Dr. Jansen give, we do research about it. We go and read about it. We go and learn about it. We test and make sure that we understand. So yeah, just want to shout that out. All right.
Thank you, Sir Shyan. Very appropriate, but inappropriate. All right. Next question. I just want to greet first our new viewer, Miss Leslie, my patient. Hi, thank you for joining us tonight. Okay. Next question coming from Miss Jan Chang'an. Can PPARS tablets mitigate H. pylori? Thank you.
Okay, H. pylori is a bacteria. You need antibiotics to kill that. But the inflammation
Yes.
because of the H. pylori, PPARS can help. But ultimately, to get cured, you need antibiotics.
So I just want to second this because my wife actually suffered from a H. pylori infection. And just not to scare you or anything, but in the end, we flew all the way back to Singapore, had to see a specialist, stay in a very expensive hospital. The whole bill came up to be 600,000 pesos for H. pylori. All right. So yeah, it's crazy, the cost. Okay. At the end of the day, the treatment for H. pylori is really antibiotics. So please, if you have H. pylori, go and take your antibiotics. Simply Nature PPARS can just, as Dr. Hansen says, can just help with the, how shall we say, the other discomforts and effects. But the H. pylori itself, you really need to take the antibiotics. So don't delay. Yeah. In fact, actually, one of the concerns, Doc, speaking to the GI specialist in Singapore, H. pylori, if untreated, can constantly irritate, and it could potentially lead to the development of stomach cancer. That's what the GI expert told us. That if you leave it there because of constant irritation to the stomach, it could potentially lead to development of stomach cancer. So don't ignore your H. pylori.
Thank you, Sir Shyan. Thank you, Dr. Jansen. Okay, let's answer 2 more questions before we wrap up. Coming from Mr. Milo, I know you said earlier, Dr. Jansen, that it really doesn't matter what medication or hormonal therapy the patient is taking. But is it also the same answer? Because this patient is taking hormonal therapy, exemestane, and next week he'll undergo radiation therapy.
Yeah, same. If you can afford it, go for the liquid. But here's the thing, no, for radiation therapy, there's a timing for taking PPARS. Don't take any antioxidants before radiation therapy because the radiation therapy will destroy the antioxidants. Okay, so always take the antioxidants after the radiation therapy. So I always advise my patients after finishing the radiation therapy, when you go home, that's the time that you can take your supplements, no, your antioxidant supplements. That includes individual PPARs. Okay.
Yeah, sayang, don't waste the money that you invest in your supplements.
Yeah, just want to inject a question thrown to us privately. My kittens were diagnosed with parvo. Can PPARS help? And which PPARS?
Ha! You need the vet. So I'll ask Sir Shyan about that. No?
Okay. Wait. What is the issue again? Sorry, I missed. I just had kittens.
Yeah, kittens diagnosed or get diagnosed with parvo, sir. Can PPARS help? And which?
Parvovirus. I think that's a very common virus that infects animals.
Okay, I can tell you one thing, right? Taking Simply Nature PPARS will help with your cat's immune system, right? Will it directly kill the parvovirus? The answer is no. All right, so it's just going to strengthen the immune system. Doc, I just want to share with you. I was talking to my vet because my old dog, right, Prosper, is 14 years old, and his liver index is 800 plus. So that is a very serious 800 plus. It's so serious that even when we do things like how shall we say, vaccination, we are concerned. He has arthritic pain in his hind legs, and we can't even give the painkillers because because of his liver index. It's so high. So me and my wife, okay, we are so desperate because we really love Prosper a lot. It's gonna be crazy, but you know what? We feed Prosper liquid PPAR extract. So and the liver index for the first time in a year actually came down. It moved from 800 plus to 700 plus. For the last year, every month it has been increasing. Every month we bring him for blood tests, right? So I told the vet his eyes also opened like, wow, because I told him how much the liquid PPARS was, and he was surprised I was feeding it for my dog. I'm just making this shout out because for all the therapeutic effects that we discussed today, all right, do know everyone that before we have results with humans, we tested them on animals. All right, so whatever we use to treat human beings actually is already proven that it will work for most animals. All right, and for your information, if you ever go to the vet, every drug that the vet sells, apart from the deworming, is exactly the same kind of drug that is sold in a human pharmacy. Okay, it's literally the same name. In fact, I buy my dog's medication from Mercury Drug. Obviously, Mercury Drug is not a pet store. Okay, so I just want to let you know, actually, animals and humans use the same drugs because before they can use it on humans, they already tested it on animals. So that means it works for animals before they went on to human testing. The only thing that is important is dosaging. And you can't do a dosage by weight, okay? It doesn't work this way. There is actually a formula that vets use to translate human dosage for drugs into animal dosage. It has to take into account not only weight, but the difference of animals' metabolism and everything. So that there is actually a special ratio that they use, okay? Just a shout out. So for everybody out there, if your dog has high blood sugar, if your dog has inflammation, if your dog has a tumor, whatever we say PPAR can help in a human, it's going to help for your dog or your cat. And it works especially well with rodents. So if you have hamsters, rabbits, yeah, it's going to work very well.
I agree. Thank you, Dr. Jansen. Thank you, Sir Shyan. I'm afraid that's all the time that we've got today. But don't worry, for those questions that we weren't able to answer, we'll have it answered privately and can also ask next week for our next week's webinar. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers who watch our 200th episode.
Yeah. Okay, I'll go first. I just want to thank all of you for the wonderful questions that you've been asking. Every single webinar, it's always different. No, always different questions. And it's really great. No, so all of you who are watching learn from one another, and we also learn from you. Okay. I want to make a request. I want you guys to follow my Facebook page as well, because I will be making announcements. Hopefully in the next few weeks, few weeks. Hopefully it doesn't take too long. But what I am planning to do right now is to make our GCC tests more available to you guys and to lower down the price. Now I have heard a lot of patients of mine who have concerns about its affordability. And to be honest, our GCC tests can be quite expensive. However, the value of our GCC's tests is we can tailor fit your protocol according to how your cancer is. Because cancer is not just a single entity. Okay, that tumor has different kinds of cancer cells. So it's basically the same family, but you have a brother, you have a sister, you have a dog, you have a cat, you have different parts, different members of the family. So the cancer is like that. No, you have one cancer as a family, and inside the cancer would be different kinds of cancer cells. Okay, so a single breast cancer, a single breast tumor can actually have different kinds of cancer cells inside that has different mutations. Okay, what makes it difficult to kill, because chemotherapy, some treatments, so even supplements, are only specific to a specific kind of cancer. Once that cancer changes its appearance, then that treatment is not effective anymore. Okay, that's why we see, even though patients have completed their treatment, we see recurrences, we see cancers coming back. No, it's because of this, because of the medical term here is heterogeneity. Okay, the variation inside the single tumor. So the tests of RGCC, the value that we can get from there is to remove the guessing from the treatment, because we can know immediately from the get-go what medication will work, what natural extracts would work for a patient. If the natural extract that you're taking or you plan to take is not in the panel of RGCC's natural extracts, we can actually even submit the sample to them for testing. So you know if it will work or not. Okay, so I'm going to make announcements in the future once the logistics part is ready, because we have to make sure everything is seamless, because this is your health, this is your life that we're dealing with, and the tests are not cheap. Okay, so stay tuned. Follow us. Do watch every single week, every Thursday, so you keep up to date, right? So that will be all, everyone. I'm gonna give the floor to Sir Shyan.
Thank you, Dr.
I think, do follow Dr. Jansen's Facebook, and I think what Dr. Jansen shared about the circulating tumor count is really a very wonderful tool especially for a specific group of people. That means those who have survived cancer, for example, 5 years, 6 years, 7 years, 8 years, and then maybe, all right, recently you don't feel too well and you're worried, right? And then you don't want to go for a CT scan. And the truth is, unless your cancer is really back, the CT scan won't be able to detect a pre-cancer stage. That means your condition is such that you won't have cancer now, but the cancer already there are cancer cells, so maybe in 1 or 2 years, it will really become cancer again. So then this is actually one diagnostic that you can use where normal CT scans will not show, but this one will give you a heads up. And then when it's at this stage, it's easy. Taking like, for example, PPAR liquids or PPAR powder will already help you overcome the cancer before it really becomes cancer again. Okay, so that's good. Again, I want to thank everybody. It's our 200th episode. It's boggles my mind. It's a privilege. It's been an honor. It's also been a journey. In fact, our advice over the last 4 years, there are certain advice that we were not too sure about. That means we were neutral about, and now we have become positive about as we learn more and more. So this is a program that we learn together as well. Good news is there has not been any advice that we backtrack. All right, so that means we've never given so far, and I don't think we will. We've never given a wrong advice. All right, but we've ever given advice that is neutral, but now we're very positive about these things, these approaches to cancer. So it's a learning program. We're learning together, and we're always very frank, and we thank you for your wonderful questions. It spurs a lot of thoughts. My advocacy to all our viewers is this: I hope that our discussion helps you choose better, gives you the courage and the confidence to choose the treatment protocol that fits you best. All right. Yeah. With that, thank you very much. Look forward to seeing all of you again next week.
Thank you, Sir Shyan. Thank you, Sir Shyan. Thank you, Dr. Jansen. On behalf of our patients, we'd like to say our appreciation to the both of you for answering our questions for tonight. And we look forward to more answers to a lot of questions next week also. All right, now at this point, I just want to say if you or your loved one is battling any type of cancer or any health issue at all, remember, science is evolving and new treatments are emerging all the time. Keep informed and explore all available options. So don't forget to like our Facebook page, Simply Nature International, and Doc Jansen's Facebook page as well. Also, do subscribe to our YouTube channel too. Now, this is also, of course, to make sure that you get updated with our latest promos and events. Now, tomorrow, guys, is the last day of February and also the last day of our ongoing website and direct order promos. So please hurry and check out our website. That's www.simplynature.asia for exclusive promos such as if you buy PPARS powder or PPARS liquid extract, you can actually get a discount of more than 280 pesos. Also, if you buy 3 PPARS liquid extract boxes, you can actually get a free bottle of PPARS tablet that's worth 1,950. So please hurry. Now, another promo is that if you buy 6 packs of soft gel capsules, you can actually get 1 more pack for free that is worth 3,700 pesos. So once again, guys, hurry because these promos are only up until tomorrow. That's a Friday, February 28th. There. So what are you waiting for? Now is always the best time to get the best health, not only for yourself, but also for your whole family. So experience the benefits of PPARS at an unbeatable price. We hope to see all of you once again in our future webinars to come, same day, same time, every Thursday night at 7:30 p.m. Next week, March 6th, we'll talk about immunotherapy, PPARS against cancer. So once again, thank you guys for watching, for supporting us, and for always being there to make this webinar a success this past year. So this Simply Healed webinar is powered by Simply Healed Medical Group and Simply Nature International. And because your curiosity about your health conditions and your victories over cancer and metabolic illnesses are what keep us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.